So what we will cover, we'll cover what physiotherapy is and any recent changes there have been in the job role, how these things have changed, how these changes have impacted physiotherapy and healthcare in general, the role of regulatory bodies and how they affect physiotherapy, and how multidisciplinary working affects physiotherapy. So we'll start with what is physiotherapy. So it's a really wide-ranging profession, and this CSP quote, so from the Chartered Society of Physiotherapists, sums it up really well. Techniques can actually be dated back to ancient Greek times, where they'd use massage, hydrotherapy and exercise to promote well-being and overall health. This continued to develop until milestones such in 1978, when physio was able to see patients without prior medical referral, and then in 1992 when it became an all-graduate entry to the profession. There are quite stereotypical views of physio, so it tends to be kind of sports rehab, massage, manual techniques, but this is actually quite a small part of physiotherapy. They're an important part of the wider multidisciplinary team in so many different areas, such as hospital wards, rehab centres, outpatient clinics, community hospitals, in the home, GP surgeries, as well as some residential settings. They aim to promote independence and kind of active participation from the patient in their recovery as well, through education, advice, and it's important with a wide range of people. So after illness, so if you've been in hospital, so let's say for an elderly person, if they've had a urine infection that's affected their mobility, if someone's had surgery, then physios can help them get back up on their feet. If you've been in the intensive care unit, the physios are there helping with airway clearance and ensuring that you get up and moving as soon as possible. During pregnancy and after pregnancy, so women's health physio, there are neuro physios that help with neurological conditions as well as stroke rehab, and as well as after injury, so on trauma wards and in outpatient clinics as well. So being such a vast and wide-ranging profession, there's a lot of room for role development. This is a visual of kind of how some areas of how the role has developed recently, which I'll go into detail in the next few slides. So a consultant physiotherapist. So the first consultant physiotherapist was Paul Watson in 2002 in a Leicester hospital trust, and there's now thought to be about, well, in 2009 there was thought to be about 64 in post. They focus on kind of 4 areas, so they tend to be experts in their field, which at the moment tends to be kind of in musculoskeletal therapy mainly. They're normally educated to master's level or have a doctorate. They can be clinical, so they can do clinics as well as focus on kind of education and clinical development, leadership and further research. It's really, really good for physio as it gives another opportunity for career progression, as well as representing physio and allied health professionals in general in management of the NHS and kind of the private sector as well as influencing further research. Similarly, there's the ACP role, so an advanced clinical practitioner. This is kind of traditionally a nursing role, but physios are able to go into this role now. The CSP website says that there aren't kind of specific activities that ACPs do, but it's up to the clinician to ensure that they are fully trained for the duties that they undertake. So these additional skills can be things like prescribing. So say in a breathlessness clinic, the physio may be able to prescribe medications that improve that, or things like taking bloods and interpreting x-rays. So again, this gives further career progression for physios. It builds on their knowledge as well. So physios already have a really good knowledge of anatomy. They already have a really good knowledge of kind of red flags. So looking at x-rays and taking bloods are a really kind of natural progression for them. And it also can prevent any delay in treatment, as physios, kind of especially in an acute hospital setting, are often waiting for outcomes of x-rays and blood results before they continue with their treatment. So physio-led weaning in the intensive care unit, so this was trialled in the Great Western Hospital as well as across the country. So it's where physiotherapists are involved in developing the weaning programme for patients that have been on a ventilator for a long period of time. So they can try and strike a balance between weaning off the ventilator successfully as well as keeping moving, improving medically, and treating the patient holistically. So this has been really successful in our trust. It means that there's been improved working and communication between the nurses and the physios, as well as the doctors as well. The patients have been well informed. There's been a programme set out. They know what they're doing. They're actively involved in their wean, and it means that the success rates have actually improved as well. So we don't physio don't go in the morning and do a really hard exercise session and tire the patient out, so they're unable to complete their wean in the afternoon. There's a bit more balance there for them. So the front door team, so this is the team that I work for. So it is a team of physios and occupational therapists, and it promotes collaborative working and shared competencies. So for physios, that means that they take on some competencies of OTs to ensure that they can do a full assessment when they go and see a patient all in one go. So they tend to work across the emergency department, acute medical units, short stay units, and it means physios are actually involved in things like trialling and giving equipment, leading on palliative or end-of-life discharges, and kind of looking at the function and cognition of a patient as well as their mobility. So this has increased efficiency. It means that a full assessment, a holistic assessment can be completed all in one go. It helps reduce the length of stay as kind of discharge plans are put in early. It means that there's less muscle wastage from the patient laying in bed for a couple of days before they get an assessment. And it also means that there's a better relationship in the multidisciplinary team. We're always there. They know to come to us if they need any help. They take kind of the advice of the front door team on board when making decisions, and it also allows the patient to be actively involved in their discharge planning as well. Within this, we've also done a paramedic handover. So a senior therapist would be present for the verbal handover between the paramedics and the senior sister in ED, and then they can help either transfer the patient from the paramedic trolley to the ED trolley and help do a mobility assessment at that point if it's appropriate. If it's not appropriate, they can also consent to contact any family members, carers, etc. At that point, so we can start again the assessments even earlier than we normally would. This has again increased efficiency. It's breaking down barriers, it's improving confidence. We know that there's kind of a tendency, if you go into hospital, you stay in bed, and that's not actually the best things for the patient, so it's kind of promoting that from early on. It's improving relationship with the paramedics and the nursing staff with the front door team as well. And it's also, paramedics have been into the patient's home. They're able to advise of any kind of challenges or difficulties that there might be in getting the patient home, which means that we're aware of them earlier. Obviously, with the current pandemic, there have been lots of changes for everybody. These are just a few of the changes that we have done in our trust. So obviously there have been lots of phone and video consultations for outpatient appointments. Outpatient physios have also done some refresher training, so they're able to go on respiratory wards onto ICU. ICU physios have done some training, so they're able to do some nursing shifts if the nurses become overwhelmed or lots of them go off sick. There's also this article here is of Diane Turner, so one of our physios at the Great Western, who put forward the End of Life Champion programme. So it was a group of therapists that would go on a rota to go and provide company, help with digital visiting for those that were at the end of their life and weren't able to have visitors into hospital. So we could help with we'd read to the patients, we'd play their favourite music, we would brush their hair, help with mouth care, personal care, anything to give them kind of a bit more of a dignified end of their life. So these changes just show how diverse this profession is, and how how physio can adjust to meet the demands on the NHS as well as the patient's needs. It's so important in recovery from injury, illness and living with a disability across all ages, and it's such a key part of the multidisciplinary team going forward. So regulatory bodies are an important part for every healthcare professional. For physio, the main ones are the Health and Care Professionals Council and the CSP, so the Chartered Society of Physiotherapists. So if we start with HCPC, so it provides a register of all healthcare professionals that are allowed to practice, and also with that comes kind of the relevant insurances you need to practice as well. So they complete CPD audits to ensure that practitioners have the right skills and knowledge to continue to practice safely. They also process any kind of fitness to practice concerns and act on those accordingly. They have standards of proficiency that are specific to the healthcare profession, so there'll be specific standards of proficiency for physio and what's expected of a physio and what they should be able to do if they're practicing, as well as more general standards of conduct, performance and ethics that they expect of all of their registrants. So the Chartered Society of Physiotherapy started life as the Society of Trained Masseurs in 1894, which has then progressed on to be the CSP as we know today. So it describes itself as a professional, educational and trade union body, and it promotes learning and development through courses and really good online resources as well. It supports new initiatives and role expansion. There's loads of articles and really interesting articles about how the role, how physio role has progressed in different trusts and different ideas. It also acts as a union, so there are different CSP reps in healthcare settings that are able to help with any queries or worries or problems, and they can also represent members as well if they need to. The CSP website is also really good for kind of collating relevant guidelines and advice from places like Public Health England, World Health Organization and the National Institute of Clinical Excellence, which has been really good at a time like now when everything's changing quite a lot. So the multidisciplinary approach, as I've said, that physio is a really important part of the multidisciplinary team, both in the community and in hospital. So it's just a group of professionals with specific specialities to help treat a patient in the most holistic way. It's really important that the patient or the person is at the centre of all of these decisions and that they're involved in every aspect as well. So we can, so it's possible to treat them in the way that they want to and what's important to them. With this comes lots of positives and negatives. So a positive is that we have professional expertise shared among multiple specialities, so every aspect of the patient's care is taken care of by a speciality and their views are taken into account. We can discuss ideas and come up with innovative kind of problem solving, come up with new ideas that maybe we haven't thought of before if a treatment is particularly complex. It's an effective use of resources and it reduces duplication, so everyone knows what page we're on, everyone knows what's left to do and what their duties are to do in the treatment of the patient. So you don't duplicate things, the patient doesn't get asked the same thing lots and lots of times, and also the patient knows where they're at and what to expect. Clinical pathways can be formulated, so things that have worked well in the past, maybe for more simpler cases, can be put into place so those specialities work in that situation again. So things like doing a total knee replacement, there's a very strict pathway that you follow after doing that. The patient knows what to expect, the clinicians know that they need to be involved, and it's a much smoother process. It gives increased opportunities to liaise with different clinicians, so you can discuss ideas and improves relationships, and it also gives a really representative an opportunity for really representative audits to show if there are any changes that need to be made. However, it can be difficult to reach a conclusion with lots of different ideas and lots of different specialities wanting maybe different things for the patient, which is why trying to keep the patient at the centre of everything is really important. There can be the possibility of some kind of speciality goals being diluted, so sometimes being an acute medical hospital, the social side of things or the physio side of things isn't kind of at the forefront of what maybe the doctors want to think of, but it might actually be the most important thing for the patient. There's healthcare is a busy place, so there can be reduced time for reflection and development, so some decisions might be rushed. It can be difficult for continuity due to the high level of turnover of junior staff. It can be confusing for the staff involved in these decisions, and it can be confusing for the patient as well. And with lots of people involved, sometimes there's blurred lines between professions, and it's a bit unclear of who might be doing what and what your role is within that. So this is a bit of a visual of how many healthcare professionals can be involved with one patient at one time. It shows quite overwhelming how it can be for the patient as well, trying to keep track of all of this. And this kind of shows that this can be across kind of the hospital, the community, treatments that they seek out as well. So how does this relate to physio? So better communication between healthcare professionals is always great. It means that people are more aware of the physio input and how important it is, and it's also good for the physios to understand how other treatments will affect their treatment. So how medical interventions might make the patient feel, and kind of adaptations that they might need to make to treatment. Chatting to lots of different healthcare professionals gives a fuller picture of what the patient is going through and what's important to them, rather than the little snapshot that you might see when you see a patient either in a clinic or in a hospital. It shows what's important to them, what's worked before, what hasn't. It allows continuity of care between the hospital and the community. Healthcare professionals start to value the input of physios, so they see the value in it, they ask for opinions, and that allows for a more holistic treatment, and it allows the patient to stay out of hospital for longer. Limitations, however, so it can de-skill staff, so having lots of people involved can mean that some parts of your role you might not take part in of as much. So physio and OT overlap quite a lot, so there might be some aspects that an OT might take on, such as hoisting and doing transfers and using equipment, that actually as the OT is there, the physio might not get involved in as much, so it can cause de-skilling. So it can hold up decision making, again with lots of ideas in the pot. It can be confusing and take a little while, especially with different priorities kind of conflicting with each other sometimes, making it difficult for decisions to be made. It also begs the question of if the training matches the job. So physios spend a lot of time with their patients, so there's more opportunities for difficult discussions, assessments of capacity, uncovering safeguarding concerns, and that can be quite difficult and time consuming, and actually it's not something that you expect when you first take on the role. And the multidisciplinary team can be reliant on physios to get the patient up and out of bed, which can cause quite a high caseload for physio, and it's difficult to keep up. So all in all, physiotherapy aims to promote the independence through exercise, education and advice. There's many possibilities to expand and develop the role to utilise the skills that physios have. Professional bodies provide the codes of conduct, and as well as learning opportunities and support for physios as required, and physiotherapists are such an integral part of the multidisciplinary team.